Okay, so what about some advice for carers, for people living with someone who might have or who already has a diagnosis of ARBD? Well, the first thing to say is that some of those early signs of ARBD can be written off by us as, or they're just being awkward, or they're just being difficult. But if you kind of piece those things together, sort of lack of motivation, not making very wise decisions, being quite irritable and impulsive, then it might mean that actually what they've got is an element of brain damage that means they really struggle to handle those sorts of things. So although it can be quite frustrating living with somebody with those sorts of symptoms, if we start to realise that they might be due to brain damage and not a sort of a conscious choice that they're making, it can start to affect the way how we deal with that. One of the most frustrating things of dealing with somebody that's got short-term memory impairment is having to answer the same question over and over again. And we can often try and force that person into remembering what we told them earlier. You know, I told you that before, can't you remember what I said? All the research shows us is that doesn't help. The way to help their memory when they ask you the same question over and over is give the same answer over and over. They're not going to remember by us forcing them to think back. But if we keep reinforcing the correct answer to them, then hopefully that will eventually have some positive impact. The other thing that doesn't help people change when they have a drinking problem is to sort of try to shame them into doing it. They have to be in the right headspace themselves. They have to want to do it, and to want to do it they have to understand what's going on. And one of the issues with having cognitive impairment is it can be really difficult to understand what the doctor's told you, and it can be particularly difficult to remember what the doctor has told you. So what's really helpful is when they go to their appointments, go with them. Listen to what the professionals are telling them, and then when you go home, repeat it, go over it, discuss it. The more that they can actually talk about the important issues, the more likely that those things are to stick in their brains, and then the more likely that's going to lead to them being motivated to want to change their drinking behaviour. People with alcohol-related brain damage have often burnt their bridges. They've often got to a state with their drinking where they've lost friendships and they've cut off family ties. All the research shows us that if we can put those things back in, if we can put the support back in around the individual, then they get a much better outcome. Because however much time they might spend with a professional having some counselling or doing some cognitive rehabilitation, the vast majority of the time they're at home with you. And that's where more support needs to happen. So go to the appointments, ask what you can do to help, and get involved in helping them with their ARBD.